I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. If you're like so many of us, millennials and older, we're talking to you. You might feel pain from simple activities, like getting out of bed in the morning.
I'm pulling my back.
What are you doing?
That's the thing, I didn't do anything, I just woke up.
But when pain lingers, it can take a toll on your physical and mental health. Chronic pain is a widespread and costly problem. Here are a few numbers for you. 25 million Americans report daily chronic pain. An additional 23 million say they experience severe pain. The Journal of American Medical Association estimates that unrelieved chronic pain costs more than $600 billion per year. And that figure includes direct healthcare costs as well as decreased productivity, like missed workdays. There's a clear need for effective solutions for pain sufferers. And today, a pair of experts joins us to discuss chronic pain and steps people can take toward finding relief. Dr. Jaden Durr, a physiatrist with ThedaCare Orthopedic Care, joins us now. Dr. Durr, welcome.
Thank you. Thanks for having me.
Can you just begin by telling us, what do you do? What type of patients do you see? What kind of care do you provide?
I see a lot of back and neck pain patients, and so I try to help navigate, trying to diagnose what they're coming in for, and once we find out the diagnosis, direct them to treatment options for them.
Okay. So we're going to ask you some questions, and these are questions that are often searched online, probably questions that you get from your patients, and we're hoping that you can address them for us.
Sure.
All right, first question here. When should I seek care for my back pain?
Back pain, it happens to a lot of us, but if it's something that's out of the ordinary or more than your usual ache and pain, or it's been going on for a long time, if you have associated numbness or tingling down the legs or arms, then that's something you should definitely see someone for.
Our next question, do women have back pain more frequently than men?
The short answer is yes. Based on the research, women go through a lot of changes compared to men. They have menstruation. Some women go through childbearing, pregnancy, and also they go through postmenopausal stage. And due to the sexual hormones being reduced after that, they are at increased risk for spine degeneration and increased back pain.
Should I see a chiropractor for my back pain?
I get that question a lot too. Generally, if the pain is not too severe, if it's kind of like a minor ache and pain, that's probably something that you could see a chiropractor for, kind of similar to what you think of like a physical therapist. If the pain is pretty severe, you probably want to see your provider first before you see anyone like a physical therapist or chiropractor.
Okay. And our final question, what kinds of non-surgical back pain treatments are available?
So we always like to start easy, and with easy, I mean take it easy at home, rest, ice, over-the-counter medications. If that doesn't help, then probably see your primary care provider or one of us, either physiatrist or pain management, kind of see whether, something like physical therapy would be an option, sometimes chiropractic, or even prescription medications like anti-inflammatories, muscle relaxers to help with the pain. And finally, if it's still pretty severe, then sometimes we do injections.
What can people expect at their first appointment?
So first appointment, if we're meeting you new, we want to get a good history and physical. We want to know about what happened. How did you get this pain? Where is the pain located? Does it radiate anywhere? So there'll be several questions about that. And then after that, we'll do a directed physical exam, whether it's for neck or back or shoulder. Depending on the diagnosis, it could be treatment options with sending you to physical therapy or injections or medications, or we could be ordering more imaging studies such as an MRI or an X-ray to kind of get more information about your issue.
Okay. And all the care teams are located in one place, so it really makes it easy for the patient.
Yeah, so, I have just 10 feet to the left of me and 10 feet to the right of me. I got the neurosurgeons on that side, so I can always ask them questions about an MRI or a patient. And then I got the pain anesthesiologists just to the left of me, and they're really good about letting me know on different options injection-wise that they can do. And so it's really nice that I can do that really quickly so the patient doesn't have to wait many days for a response.
How can people prevent back pain?
If you do a lot of physical work, you want to make sure you're using your posture is correct. You want to make sure you're using your legs. You make sure you're using advantageous positions for your back. So you want to be as straight as possible. You want to maintain a healthy diet. You want to do regular exercise, and stop smoking would be another one.
Okay, all great recommendations. Thanks so much for being with us, Dr. Dorr. We appreciate it.
Yeah, thanks for having me.
Nearly 620 million people worldwide live with low back pain. Dr. Matt Fisher joins us. Dr. Fisher, you are an anesthesiologist and medical director of pain management here at ThedaCare. We appreciate you being with us.
Yeah, thanks for having me. Happy to be here.
So today we're going to talk about chronic pain, ways that you can cope with chronic pain, and maybe some treatment options that are available.
Perfect.
Let's talk a little bit about low back pain. What does that mean, and what does that indicate?
Well, there's a lot of reasons that patients can suffer from low back pain. We try and divide it between how recent the onset is. So if you fell off a bike and you have low back pain, that's something that's likely due to a muscle spasm or a muscle strain. Rarely you can have something like a fracture of the bones that leads to back pain. But statistically speaking, most of the patients that we see in the chronic pain offices here at ThedaCare have some combination either of degenerative conditions, that could be arthritis in particular joints in the back, or arthritis that's leading to pinching of nerves transmitting down in the low back, or what we call myofascial dysfunction. So myofascial dysfunction refers to the soft tissues of the lumbar region, so the muscles and those types of things.
When you have hip and buttock pain, that comes with maybe some low back pain as well. What does that usually mean?
When my patients report combination of pain in the hip and then radiating to the buttock or from the back down into the hip, we think about it could potentially be an indicator of underlying arthritic changes. Specifically, we think about arthritis in what are called the facet joints. So the facet joints, using this model here, are the small joints that are on the sides of the spine, both the left and the right side. And along with the disc that's actually at the front of the spinal complex, they help perform the articulations or the joints in between each level of the backbones. And so if patients develop arthritis in these facet joints, just like arthritis in a hip or a knee, you can experience pain from that pathology.
Another one we hear often is a complaint about sciatica. What is that, and who might experience something like that?
Yeah, so sciatica is one of many terms for pain that is described as radiating from the low back and then down the leg. The classic example is when the pain is due to a disc herniation or a disc disruption. And so again, using this model, there's discs that serves as the cushioning shock absorber in between the backbones. And for whatever reason, if you have a disc that's herniated out toward the side, impinging or creating inflammation that will activate these nerves that are exiting down the leg, then you can experience these searing pains into the leg known as sciatica. Sometimes we'll call it radiculitis or radiculopathy as well.
Who might experience something like that? Is there like a common type of patient that you might see?
Well, it tends to be a bimodal distribution, meaning many of our patients that we see with the down the leg sciatica pains are either relatively younger, where they've had some type of injury that leads to a traumatic disc displacement. A classic example is someone who is lifting a heavy weight maybe. But then there's also a fair number of patients who experience sciatica not from an acute disc herniation, but from basically a collection of arthritis that occurs with time. And so our older individuals.
Okay. So for a lot of people, managing pain is probably a lifelong journey, and living completely pain-free may not be achievable for everyone. So can you tell us about the treatment options that are available and ways that people can manage chronic pain?
Our goal for every single patient is what we call functional pain relief. To the extent possible, we want you to be able to do what you want to do without being quite so limited by whether it be your back pain or your other pain conditions. Now, certainly you have to take things with a grain of salt. You know, if you're in your 8th or 9th decade, you're probably not going to be running marathons anymore. But we try and take a multidisciplinary approach to treating our patients with chronic pain. Much of what I do and what my partner Dr. Brooks does as anesthesiologist involves the interventional management of pain, but we also try and find a combination of medications that would improve symptoms for patients, always trying to balance the benefits for pain relief with trying to minimize side effects when at all possible. And then we're also very fortunate to have what's called a cognitive behavioral therapy program, the mind-body approach to trying to live or cope with chronic pain. We're trying to help equip patients with the tools to decrease the impact that that pain has on their life. So, for example, some days your pain may be flared. Instead of the typical 3 or 4 on the pain scale, you could be up to 7, 8, or 9. And so what are some techniques that we could try and use, whether that be guided imagery, visualization techniques, biofeedback techniques, things to try and get you back down toward your baseline. There's a lot of active research in the pain management literature regarding biofeedback and mindfulness specifically, and we're fortunate to have a pretty comprehensive program here at ThedaCare.
Okay. Thanks so much for being with us, Dr. Fisher. We appreciate all the great tips you shared.
Yeah, thank you.
And remember, you don't have to live with pain. To get started, talk with your primary care provider or call ThedaCare Orthopedic Care at 920-831-5050. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.